Discuss about the infectious disease. This is a very much important topics in your life. Remember, this is our daily practice. Infectious disease. This is very much important, and not less than 30 diseases here included here, including immunization schedule. I also show you some changes. Look to the immunization schedule. There is two changes there. One is oral polio vaccine is changes to oral polio is the biopb, and FIPB changes to only IPB. Remember, the two changes is there. Remember this one. Next, this is the immunization schedule, updated immunization schedule in 2017. 2017 changed this one. You remember this. Next, I like to highlight all of the from the infectious disease. Tuberculosis. Tuberculosis is a very much important disease for your daily life. Remember this. Both pediatrics and internal medicine, very much important in tuberculosis. Before starting tuberculosis, you must know the tubercular bacilli. That's a mycobacterium. Mycobacterium is, you should know what is mycobacterium. It is slides. It is a straight curved rods. More than 50 varieties of species discovered in the world, but there's 4 varieties, 3 to 4 varieties more common as mycobacterium. One is mycobacterium human type, another is mycobacterium bovine type, another one is mycobacterium leprae. Remember, these 3 is very much important. And also there is some atypical mycobacteria. Remember this, which causes opportunistic infection to the immunocompromised patient. What are the atypical mycobacterium? That is Mycobacterium kansasi, Mycobacterium ulceran, Mycobacterium avium, Mycobacterium bellani, Mycobacterium africanus. These are all of the atypical mycobacterium. But this, now you should know the characteristics, how the characteristics morphology of the mycobacterium. This is non-capsulated, non-flagellated, and non-motile and non-spore bearing. Remember this. It is resist to discoloration of the alcohol staining and acid staining. So it is called acid part bacilli. Remember this one. Now I go into the disease. How the infection is spread to the people. How the infection is spread to the people? It is spread through the inhalation. Droplet molecule inhaled by the peoples, and Mycobacterium bovine is infected by the drinking of the contaminated milk. Remember this. Now I am thinking about the Mycobacterium tuberculosis. When you inhale the mycobacterium is going to alveoli, then it is ingested by the macrophage. Then is a multiplication of the mycobacterium into the macrophage, then is spread to the lung tissue. Then lung tissue that is spread to the regional lymph nodes. Lung tissue and regional lymph node. These two together is called primary complex. Remember this. Very much important. What is primary complex? You should know primary complex. Now you should know what are the fate of the primary complex. You should know it may completely healed by calcification or fibrosis, or it may progress to lymph node, progress to lung tissue, and lymphohematogenous dissemination to the liver, spleen, kidney, and bone marrow. This is a miliary tuberculosis. Remember this. What are the sign syndrome? What are the sign syndrome coming to this patient? Prolonged fever with cough. Sign syndrome. How the patient is present to you? Prolonged fever and cough, wheezing, chest pain, and weight loss. Remember this. These are the patient is coming with this complaint. Patient comes with prolonged fever with cough, then wheezing, weight loss, night sweating. Remember, these are the clinical manifestation. Now, in my pediatric test, you should thinking about the diagnostic criteria. What the diagnostic criteria of the childhood tuberculosis? You must know. What the diagnostic criteria of the childhood tuberculosis is not mentioned in your book, but it is from the text. It is from the guideline. The diagnostic criteria, 3 or more of the following criteria. Remember this, 3, look, 3 or more of the following criteria. What are the following criteria? Symptom criteria suggestive of tuberculosis, contact with the tuberculous patient. That is history of the recent contact with the tubercular patient. Number 3, physical signs suggestive of tuberculosis. Number 4 is positive Montrose test. Number 5, excess suggestive of tuberculosis. This is the more total 5 points. Out of 5, 3 points is if 3 or more criteria is here, then you diagnose the case of childhood tuberculosis. Remember this. Next, you should go about the, or what are the difference between the adult, what is the difference between childhood tuberculosis and adult tuberculosis? Childhood tuberculosis is always, it is due to the infection from the offend case. Infection is inhaled from the offend case, and adult tuberculosis is due to the reactivation or reinfection of the tuberculosis. Remember this. A site of lesion, very much important in childhood. Lesion in the lung, the peripheral part of the lung is involved, but adult is effects of the lung is affected more. Remember this. Now it is how it fate is calcification. That is, in childhood tuberculosis, it is complete healed by the calcification, but in adult tuberculosis is healed by the fibrosis. Remember this. And cavitation is uncommon. Cavitation is uncommon in childhood tuberculosis, but adult TB, that is, cavitation is more common. Remember this. Lymphohematogenous dissemination is very much common in childhood tuberculosis, but is uncommon in adult tuberculosis. Remember this. This is all about. Now you should go for the investigation. Already I told to you how the investigation goes for. What the investigation goes for diagnosis of the tuberculosis. First of all, sputum smear. Sputum smear. Prefer for smear in gel Nielsen staining. Then it is given the culture of the sputum or any body fluid into the Lowenstein Janssen media. Lowenstein Janssen media, it will record time 4 to 6 weeks. Another media is Bected media. It's Bected media. Culture in the Bected media requires time 2 weeks. Next one is in lymph node biopsy. Lymph node biopsy, you see there is a caseation. That is caseatic lesion of the lymph node. This is also very much important for TB lymphadenopathy. Remember this. Next, last one is latest updated investigation is gene expert. You should remember this. What is gene expert? You should know. What is gene expert? You should know. Gene expert means, what is it? It is an instrument. It is an instrument used to conduct the rapid diagnosis of the TB and detection of the rifampicin. This has rifampicin resistant within 2 hours of the time. This is called your gene expert. We detect with detection of the DNA molecule in the sputum, and see any change in the DNA molecule which causes rifampicin resistance. This is called the gene expert. Remember this. Now what is the treatment? Treatment is anti-tubercular drugs. Treatment should be given anti-tubercular drugs. Anti-tubercular drug. Treatment should be given anti-tubercular drug. What is the anti-tubercular? How it classifies the anti-tubercular? How it given? Anti-tubercular how given? It is given that three types. One is category 1, then category 2, then category 3. Remember this. How the treatment is given? That is category 1, category 2, and category 3. Category 1 is fresh case, fresh tuberculosis with cavitation is given the category 1. A category 2 will be given what? Which is treatment failure, recurrence, relapse tuberculosis, recurrence tuberculosis should be given the category 2. And category 3 was given the multi-drug resistant tuberculosis, extended drug resistant tuberculosis given the category 3. But I'm here given the category 1, the 3 FDC, 2 FDC and 4 FDC. But here in children given the 3 FDC, always remember, in children given 3 FDC except two diseases. One is bone TB and meningeal TB. TB meningitis. A bones TB, there is a 4 FDC should be given. Remember this. And duration of the time is only 6 months. Initially should given rifampicin, isoniazid and pyrazinamide for 2 months. Then next 4 months is isoniazid and rifampicin. Except bone TB and meningitis, TB meningitis. And bone TB there we should give a rifampicin, isoniazid, pyrazinamide and ethambutol, 4 drugs, that is 4 FDC, given initial 2 months. Then next 4 months is isoniazid and rifampicin. But in TB meningitis should be given also 12-month therapy, 12-month therapy. There are also 4 FDC, that is rifampicin, isoniazid, pyrazinamide and azithromycin for 2 months. Next 10 months should be given rifampicin and isoniazid. Now you should know what are the adverse effects of the TB drugs. What the adverse effect of the TB drugs is very much important. Adverse effect of the TB drug, you should understand this one. INS, peripheral neuropathic, rifampicin, hepatotoxicity, pyrazinamide, this is the hepatotoxicity. Then ethambutol, optic neuritis, remember this, steatomycin causes ototoxicity, remember this one. Steatomycin causes ototoxicity, remember this. Ethambutol causes optic neuritis, remember this. This is all about. Thank you very much for patient hearing. Thank you very much for patient hearing.